The lens in our eye that you're born with begins to age, and by the time we're about 40 years of age, that lens, which the cells you have in the lens and right behind your pupil of your eye, have been there since you were a fetus. And those cells are designed to last a lifetime, but by the time we're in the middle of that lifetime somewhere, the lens is beginning to get a little stiff. So historically, the lens could flex, become thin or become thicker by using muscle power around the rim of the lens. By the time we're in our 40s, it's getting a little stiff. And it's one of our first indications that we're aging. Most of us don't like that. We have a way to help you with that particular problem. That stiffening of the lens is called presbyopia. And presbyopia is normally corrected by wearing magnifiers. You can't magnify the lens in your eye. Magnifying meaning make it thicker like this because it's become stiff. And so we give you magnifiers, and magnifiers work very well. If your vision is perfect for distance, you put on Walgreens magnifiers to magnify things so you can see them up close. And this has been the age-old solution for this. But in our era, as a refractive surgeon, we've used other methods. And so contact lens wearers will wear one near contact lens and one distance contact lens. This is called monovision. We sometimes refer to mini monovision. That's where you could have one eye seeing a bit further out and the other eye seeing distance. Mini monovision has some advantages. It gives you more depth perception at distance. And we can mimic that exact same technique using the laser. So laser vision correction, we often provide a patient who is in their 40s or later with the ability to see mid-range, near, and far by having one eye, usually the non-dominant eye, cover the near for you and the distance being covered by your dominant eye. Then camera. So the camera technique is using a tiny inlay placed right over the visual axis, right in the center of your pupil, 6 microns thick, 3 millimeters wide. Looks just like your pupil. It's a black object. You can see it on my website, glassesfree.com. And by looking through this tiny little pinhole, it allows you to see both near and far out of your non-dominant eye. We only put it in one eye, and the procedure takes about 5 minutes. And that technique has been just approved by the FDA. We're one of the chosen sites here in the United States to be placing them, and we've had tremendous success with this new technique. We're very excited about it. I'm Dr. Richard Foulkes. If you have more questions about this, call our phone number, 630-724-1400, or go to our extremely informative website, www.glassesfree.com. And remember, there's no charge for your initial consultation.